my name is Sara Cates. I'm a physical therapist here at Rehab United, and in honor of PT month, I wanted to talk about total joint replacement, specifically a total knee or a partial knee replacement. And there's two things that really come to mind as a therapist who's been in the field in terms of misconceptions with the layperson's thought on getting a total knee replacement, is that with the brand new instrument, your knee is a brand new knee. But people often forget that there's compensations that were going on prior to surgery that we do need to address for. So I've used a dowel here just as a demonstration. When someone is walking at us and we see a lot of what's called valgus, or the line of pull is angled inward, like a knock knee, or the opposite, which is more of a bow-leggedness, or the line of the pull is outward, that can play a very big part on the hip and the ankle. So when you get assessed by a physical therapist, you want to make sure that they're checking your gait assessment or walking assessment to make sure that your knee is tracking properly. So come on over to the cage. I'm going to show you one quick stretching technique we'll use. I'm first going to start just as an example. If you were that valgus deformity patient who had a lot of arthritis in the knee and this is how your knee presented pre-surgery, we may give you a simple specificity technique of a calf stretch that helps straighten the knee out, similar to this. So that wedging technique helps straighten your knee out to proper stretch your leg. The second thing that people have a misconception is how quick they'll get back to weight-bearing activities. So I wanted to show you some pieces of equipment that we use here in order to ensure safety when returning to full weight-bearing. So come on over to our equipment. The first thing I like to do for range of motion is a stationary bike. It really allows the patient to not put too much pressure through that joint, but really work on their range of motion. And then we advance to an elliptical, which looks a lot more like walking or running. To start replicating the gait stride. And then the third thing we'll use here at Rehab United is what's called an Alter G. So come on over, I'm going to show you our unloaded treadmill system. We're not going to turn it on just because we don't have a patient in there, but I did want to show you. It's a machine that's designed to put you in this apparatus where you're wearing a skirt. We put you in the treadmill machine, lift off some of your body weight, and then you can go for a walk, at 50% of your body weight, 75% of your body weight, or full body weight if the therapist recommends. So just a couple of things for you guys to think about. Happy PT month. Thanks for letting me share.